Good morning. It is 10 minutes now past the hour. In the United States, 5% of adults have either underactive or overactive thyroid issues. And more than 1 million people are living today with thyroid cancer.
You know, thyroid medication is one of the most frequently prescribed medications. So we have our doctor, Archelle Georgiou, our medical expert here to talk about all this, including what medication should be taken, who should need it. And I was just asking you, I feel like the thyroid is underrated, at least as a man. I don't talk about it much. I don't, know much about it. I know it's in this vicinity right here.
So where is the thyroid? Let's start with that. So have you ever been to the doctor and they go behind you and they touch your neck? Do you ever wonder what they're doing? They're feeling for your thyroid. So the thyroid is a butterfly-shaped organ that's sitting right around, it wraps itself around the trachea, which is that hard cartilage in the front of your neck that you can feel. And it's like your body's thermostat. It controls your temperature, it controls your heart rate, and the thyroid makes two important hormones, T4 and T3. And they can either be high or low. So interestingly, to test whether or not you have a high or low thyroid, you test another hormone called thyroid stimulating hormone, TSH. Probably people have heard of that, because it's really your brain that is sensing whether or not you have enough thyroid hormone or not. So when you don't have enough thyroid hormone coming from your thyroid, your brain says, make more, and it pumps out TSH.
Okay.
If you have too much, your brain says, have enough, and it shuts down. So TSH is a less expensive, easy screening test that's used to see if you have a high or low thyroid function.
Okay, I've heard thyroid discussed at times like, I'm so tired, my thyroid must be off. Is that, you said it regulates your temperature, but what else does it do for your body?
Well, it regulates the metabolism of your metabolism, which means every cell of your body. And it's certainly possible that a low thyroid could create symptoms of fatigue and weight gain and feeling cold and dry skin. Those are all classic symptoms of a low thyroid, but they're also classic symptoms of a lot of other things. So often people think that I have these symptoms, therefore I have low thyroid.
Yeah.
But not always, and that's why it's important to get it tested and make sure that the test result is accurate, because oftentimes you can have a low thyroid, but it's just a blip and it comes back to normal.
Well, let's say you have an elevated TSH. Does that mean medication right away, or is there something that you can do to lower that a little bit?
Well, the first thing that you should do if you have an elevated TSH is to retest the TSH, because about 68% of people who have an elevated TSH will have a normal TSH the next time their blood test gets tested. But then, before you treat at that point, you do the next level. So a TSH is just a screening, right? It's a less expensive test for the whole population, or the population that gets screened. But then you want to test the actual hormones, a T4, which is one of the important hormones that the thyroid makes. And if your TSH is high and your T4 is low, you're not making enough, then that would be the indication to get thyroid medication.
And this is all blood testing, right?
It's all blood testing, yes.
What if you take that test and it comes back low, your TSH? What if how do you treat that?
So if your TSH comes back low, that means that your brain is sensing that you're making enough, or sometimes
It's too much. That's the medication kicker. That when one's high and one's low.
In either direction.
Oh, okay. Now I understand.
Yes.
Okay. So let's talk about the other side of things. What about when your thyroid is overactive?
So the classic symptoms are the opposite of when it's underactive. Again, your body's thermostat. So you might have weight loss. You may feel anxiety or jittery. You may have a racing heart rate or an irregular heart rhythm. Your skin may feel a little thinner. You may have your hair falling out. So it's opposite symptoms of that. And the most common reasons for having an overactive thyroid, 99% of the reasons in the United States, is called Hashimoto's thyroiditis. It's an inflammatory condition of the thyroid, and it causes, again, 99%. It's an autoimmune condition. Globally, around the world, another somewhat common reason is an iodine deficiency. That's not something that we're dealing with in the United States. There are some other much more rare reasons, but I put them on the screen so that we can be complete. Medication, surgery, infection, they can cause an overactive thyroid as well. But regardless, if you have this low thyroid, the standard treatment is oral thyroid replacement medication. The brand name that most people are familiar with is called Thyroid.
So when a doctor is feeling you, obviously they're feeling for nodules. And when a doctor feels one and he goes, oh, we might need to take a look at this, is that, should I be scared right away if there's, something on my thyroid?
It needs to be followed up on. Let's just say that. I don't use the word fear very often. So they are feeling for an enlarged thyroid and they're feeling for nodules. And if they do feel a nodule, then the first thing that they should do is get an ultrasound so that they can see how large that nodule is. It is really common to have a nodule, and the vast majority are benign. Only 1 in 20 might become cancer. And so they're really not a lot to worry about, but they are something to monitor. So interestingly, if that nodule is making excess hormone, it's making excess T4 or T3, it's almost definitely benign. If it's just sitting there doing nothing, but it's a nodule, it is slightly more likely to be a cancer. So you need an ultrasound, and then if it's larger than a centimeter or if it's getting larger, then they'll do a biopsy to see what the cells look like to make sure it's not cancer and just something to watch.
If people are going in for their yearly physical, is it something that they should ask their doctor to test if they're healthy and don't have any other symptoms of things?
So I'm going to tell you the official guidelines because I feel a responsibility to do that, and then I'll tell you my personal opinion.
Okay.
So I want to separate the two. So the official guidelines are that screening for thyroid across the general population is not advised because all of the science says it doesn't make a big difference. However, it's inexpensive to do. It can identify issues, and doing it once or twice as a screening at a routine physical, your doctor's probably doing it anyway, to be honest with you. So I have certainly had mine checked, and I would recommend it, but the official recommendation is that it's not a routine screening test.
A lot of great information. Little did I know that
it's really
it was so important. Yes. Thanks for joining us, Doctor. We appreciate it. For more medical news and how it impacts you, check out Dr. Georgiou's podcast. It's called Speak Up for Your Health. We'll post a link to episodes on MinnesotaLive.com.